to another wonderful episode here at Jaws Podiatry. We have a young patient who has traveled from abroad with a chief complaint of multiple hammertoe deformities, both fifth toes, with really ugly corns that the patient has been battling for approximately 6 years in duration. During the course of the last 6 years, the patient took the liberty to not only use over-the-counter remedies,
Exactly, yes.
corn removers,
Yep.
makeup, tattoos, none of which
Worked at all.
worked at all. So the patient finally decided to seek,
Medical treatment, medical attention.
and that's what brings the patient here today.
Exactly.
So, the nice thing about the hammertoes, right? We'll talk a little bit about hammertoes without the corn, and then we'll address the corns as well. In respect to the hammertoe correction that we perform, we use all of our minimally invasive techniques. One little suture, maybe one on the top as well, if needed. And these techniques just simply work and work really well. We don't use any pin screws or plates. We're in our office-based surgical suite. Patient is awake, local anesthesia. Patient walked in, is going to walk out.
Yes. Patient was awake the entire time, and the patient will be walking out today after my procedure. And before the procedure, so.
Right. So it took
30 minutes at the most.
30 minutes, both feet.
Mm-hmm. Yep.
Lunchtime, procedure.
Yes.
And already the patient is extremely happy.
Very happy.
That's kind of like the nice thing of what we do now. Let's talk a little bit about the corns. There is no way, even though we have refined to the best of our abilities these techniques, there's no way to excise these ugly corns using one stitch. There's just no way. But we have refined our surgical techniques to make sure that we achieve the most aesthetic clinical outcome. So Caesar, without further ado, we'll definitely plug in the before pictures, and now let's show the world. Okay, so we're looking at the bottom of the foot, one suture. So just to be very, very clear with the entire world, if there was no excision of the ugly corns today, it would only be this one suture. Okay, let's bring the toe, there we go. So this is where we excised the pesky ugly corn. As everyone can see, the toe is straight. We're gonna go ahead and rotate, and I'll go ahead and show you guys the right foot, but we're gonna go ahead and rotate. We don't use any pin screws or plates. So now we implement very delicate and intricate taping and splinting techniques. So we're gonna hold the toe nice and straight like that for a period of about 3 weeks. It's gonna be wonderful. Patient, again, like I said before, walks in, walks out. Patient can do, get back to daily life activities, work, tomorrow, not a problem.
Right.
Not a problem. Let's take a look at the right, Caesar. Okay, and taking a look at the right, same thing. We have already, this is what we use, a little steri strip. Okay, and we're gonna go ahead and implement this again for about 3 weeks. Let's take a look at the bottom here. There's that one suture, and that's it. So, this is just, using these minimally invasive techniques has really changed the way that we approach these structural and biomechanical deformities. We use the same principles not only for hammertoes, but also for bunions of the world, for Taylor's bunionettes of the world, and basically the sky's the limit. But, we will continue to refine our surgical techniques to make sure that we're able to deliver the highest standard of the care. Would you like to say anything to the world in respect to your experience here with us?
I would just like to say that I came in, the office staff was very friendly. Dr. Wagner and staff was very kind, very welcoming. And today, just walked in, was numb within a few seconds, walked over to the OR, had the surgery. I didn't feel any pain or anything like that. Dr. Wagner he explained everything he was doing throughout the procedure. It only took about 20 minutes, and I did not feel anything. So I would recommend that, you know, if anybody is having or experiencing these unsightly corns on your feet, or you have any hammertoes, please come to Florida, Fort Lauderdale, Hollywood, and see Dr. Wagner.
Thank you. We will continue to do what we do. Caesar, do you want to say anything?
It's all you.
You tell me. We will continue to do what we do. We will continue to educate the world that these minimally invasive anesthetic procedures do exist. Education at the core of what we do is the key. People don't know that these procedures do exist. They don't. You know, and that's part of our goal, to educate.
I mean, and it's also a confidence booster, so I am so excited. I'm going to most definitely follow his recommendations, his treatment plan throughout these next 3-4 weeks, and just look forward to seeing what the aftermath was like. So.
Yeah, I mean, you know, and we spoke about, you know, the different skin types as well. That's something that we take into consideration in respect to, you know, people that may heal with, you know, either a keloid hypertrophic scar. We take those, you know, variables into consideration. And of course, you know, we spoke also about the scar, you know, management program afterwards. That's something that we also implement to make sure that we maximize the aesthetic elements. As always, thank you for watching.